What laboratory tests are included in bladder diagnosis procedures? When it comes to diagnosing bladder conditions, laboratory tests play a vital role. They help identify issues like bladder cancer and other bladder health concerns. Let's explore the key laboratory tests involved in bladder diagnosis procedures. First up is urinalysis. This test examines urine for any abnormalities. It can reveal the presence of blood, which is a common early sign of bladder cancer. Urinalysis also checks for white blood cells, indicating possible infection or inflammation. Additionally, it looks at protein levels and other substances that might suggest bladder or kidney problems. This test is often the first step when a bladder issue is suspected. Next, we have urine cytology. This test involves a microscopic examination of urine to find abnormal or cancerous cells that may have shed from the bladder lining. It is particularly useful for detecting high-grade bladder cancers, helping to distinguish between benign and malignant conditions. Another important test is urine culture. If a urinary tract infection is suspected, this test can identify the bacteria causing the infection. This is crucial since infections can mimic or coexist with bladder conditions. There are also emerging biomarker tests. These specialized urine tests look for molecular markers associated with bladder cancer. However, they are not yet standard and should be considered adjuncts to cytology and cystoscopy. While cystoscopy with biopsy is not a laboratory test, it is significant in bladder diagnosis. This procedure allows doctors to visualize the inside of the bladder directly and take tissue samples for further examination. The biopsy specimens are sent to pathology labs to confirm the type, grade, and stage of cancer if present. Imaging tests such as computed tomography scans, magnetic resonance imaging, and ultrasound are complementary but do not replace laboratory tests. They help assess the bladder and surrounding structures. In summary, the main laboratory tests in bladder diagnosis are urinalysis and urine cytology. They help detect abnormalities in urine that suggest bladder disease, including cancer. These tests are often combined with cystoscopy and biopsy for a definitive diagnosis. Urine culture may be used to rule out infections. Patients experiencing symptoms like blood in urine, frequent urination, or pain during urination should seek medical evaluation promptly. Early detection significantly improves outcomes in bladder cancer and other bladder diseases. Always consult healthcare professionals for personalized care and interpretation of diagnostic results.